Welcome, everyone. It's now 2:02. I am Sharon Middleton, Chair of the Economic and Community Development Committee. We are here this afternoon to hear Bill number 21-0028R. In attendance, we have the Chair, Sharon Middleton. We have Councilman John Bullock of the 9th District.
Thank you, Madam Chair.
We have Councilman Conway of the 4th District.
Thank you, Madam Chair.
We have Councilman Ryan Dorsey of the 3rd District.
Thank you.
We have Councilman Glover of the 13th District.
Thank you, Madam Chair.
Councilman Ramos of the 14th District.
Thank you, Madam Chair.
And Councilman Stokes of the 12th District.
I'm here.
Thank you, Councilman Stokes. And just a quick check to see if any other additional council members have joined us, and I don't see any. Members from the Office of the President, we have Nikki Thompson,
Thank you, Madam Chair.
Aaron DeGraffenreid,
Thank you, Madam Chair.
Matt Stegman,
Chair.
and Lucy Font.
Thank you, Madam Chair.
Representing the mayor's office, I know Christopher Shorter is going to be joining us, but I don't.
Afternoon, Afternoon, Madam Chair. I am here.
Oh, good afternoon. Hi, how are you?
Very good, Madam Chair.
And we have Nina Thimulus.
Thank you, Madam Chair.
And is Natasha with us today? I don't see her. Okay. Okay, before we begin, I would like to remind you that if you're not speaking, please keep yourself on mute. Please do not take yourself off of mute unless you are recognized by the chair. When you are recognized, please identify yourself and the organization or agency that you are representing. Once you finish speaking, please put yourself back on mute. And let's begin. Bill number 21-0028R, landlord-tenant lease renewals, for the purpose of inviting the acting director of the Mayor's Office of Homeless Services, the director of the Mayor's Office of Children and Family Success, the city administrator, okay. Let me back up. I've just been noted, I read the wrong name. So it's the informational hearing. It's the correct bill number, but it's an informational hearing. Baltimore's plan for our neighbors experiencing homelessness and residing in hotels during the pandemic. For the purpose of inviting the acting director of the Mayor's Office of Homeless Services, the director of the Mayor's Office of Children and Family Success, the city administrator, the acting commissioner of the Department of Housing and Community Development, and the advocacy groups Housing Our Neighbors and Homeless Persons Representation Project to brief and advise the City Council as to the overall outcomes for neighbors experiencing homelessness who were able to reside in the hotels, what is next for them, assistance for those experiencing. This bill was introduced on March 8th, 2021. This bill is sponsored by Councilmember Ramos, and we also have Christopher J. Shorter, the Chief Administrative Officer for the Office of the Mayor. Before we begin, I just want to do a friendly reminder for all agencies reporting, not just on this bill, but on all bills that we hear in this committee. Natwana, basically after every council meeting, right away, she sends referrals to she sends referrals out to all of the agencies. And we're still getting reports the day before. So on behalf of this committee, we have bills lined up right now, basically till the end of June, and I'm sure more will be added on. This is like a very busy committee, I'll say, and it just, the committee needs time to go over and read the reports. And it's not fair to the committee when we get reports from agencies that, like at the last minute or the night before, we definitely need the reports in early. And as I mentioned, this particular bill was introduced on March 8th. So just sending this friendly reminder out to the mayor's office and all of the agencies that it's imperative that we start getting reports on time. I don't want to have to cancel hearings because we don't have reports in, and we need time to read the reports. So I can't reiterate that enough. We're going to start public testimony, but we definitely want to hear from Council Member Ramos, which was the sponsor of the bill. Councilmember Ramos.
Thank you, Madam Chair, agencies and members of the committee. I really appreciate your time today to discuss this really important issue about what our neighbors experiencing homelessness are going through, what the actions of the office entailed to try to mitigate the spread of COVID during the pandemic, and then what's next. I had submitted some written testimony, and you can see some of the questions that I had are, how are folks doing now? How has what are the outcomes from what has happened with our neighbors experiencing homelessness who've been living in the hotels and the encampments? And then what are the next steps? It's not going to be okay if they end up on the street again. So we want to know what those strategies are. We want to understand the federal funding and FEMA and how that's playing in and how much time do people have. So I know that the Mayor's Office of Homeless Services just got a new director and associate director. I understand that the new director is not here today, but she will be listening in. And so we're not going to pass this out today, but have this as a part one and then as a part two for later. And again, I think that the city did the right thing by reaching out and making sure that more people were housed during the pandemic. And also we have encampments throughout the city that were not cleared so that everybody could isolate on their own. But we need to know what the next steps are and how we as the council can be helpful to make sure that everyone is stably housed and that we are doing as much as we can with the federal money and ongoing what needs to happen. So thank you, Madam Chair. Thank you to the committee. I also have a panel from Housing Our Neighbors and from Homeless Persons Representation Project that we'll hear from in a bit. And then I also look forward to the testimony of the agencies because they've been working on this so hard moving forward. So thank you, Madam Chair, and thank you to the committee.
Thank you, Councilwoman Ramos. So now we'll begin with the committee will now take the public testimony from the panel. And just for a check, we have the Homeless Persons Representation Project, which has a presentation. And oops, I'm gonna back up again. I know that Christopher Shorter has another obligation, so we want to hear from you first, and then we'll go with the presentation. And then down the road, there's another presentation from the Mayor's Office of Children and Family Success as well. So, Mr. Shorter, you're on.
All right. Thank you. Thank you very much, Madam Chair Middleton and Honorable members of the committee, as stated, I am Chris Shorter, City Administrator, and I am honored to provide remarks and testimony in reference to Bill 21-0028R. I understand the council has convened this informational hearing to better understand the city's plan for our neighbors experiencing homelessness who have been residing in hotels during the pandemic. I would like to start by acknowledging the staff and leadership from across the government who have moved quickly and effectively to respond to the intersecting public health crisis we know as chronic homelessness, as well as to the COVID-19 global pandemic. I'm proud of the work that they have done to ensure that our efforts to provide safe and non-congregate shelter options for individuals and families experiencing homelessness was successful. I also would like to note that this work was done in isolation. Well, it was not done in isolation. I apologize. The work of our community stakeholders and partners have been critical as we have navigated our city's response, and it will be key to our future success. I am joined, as you stated, Madam Chair, today by some of the agency's leadership from the Mayor's Office of Homeless Services, the Mayor's Office of Child and Family Success, our Department of Housing and Community Development, the City Solicitor's Office, and the Department of Finance. They will discuss some of the specifics of our response, but I'd like to just briefly touch on how the pandemic has shined a light on how government and non-government stakeholders can collaborate to develop innovative solutions to some of the most complex and entrenched issues we have faced in Baltimore. The mayor has already expressed his commitment to implementing an anti-homelessness strategy that solves both the acute needs that are being elevated through this crisis and the long-term strategic solutions necessary to make homelessness in Baltimore rare, brief, and non-recurring. To lead this work, the mayor has appointed Irene Augustine as the director of the Mayor's Office of Homeless Services. She has a deep and rich history and experience across multiple municipalities and will take the reins to lead the implementation of an anti-homelessness strategy. Her experience spans an array of responsibilities across the continuum of care, including direct experience addressing issues such as the use of hotels for temporary shelter. She will be joined by Bill Wells, who will serve as the Deputy Director of the Mayor's Office of Homeless Services. Many of you know Bill currently because he serves as the Senior Vice President for Business Strategy at the Housing Authority for Baltimore City. He will play a very key role in deepening the partnership with the Housing Authority, which is essential to making more affordable housing options available to our neighbors experiencing homelessness. When COVID-19 began in March of 2020, the city acted and implemented the COVID-19 response plan swiftly. This response has resulted in the city managing 6 hotels and motels with over 500 beds in order to offer non-congregate shelter options. These hotel beds were offered in addition to the 4 city-funded shelters which experienced diminished capacity due to the need for social distancing. These actions have helped reduce community spread in a population that is particularly vulnerable to the most negative health outcomes from the virus. Now, as we enter a new stage in our response, we have issued an RFI to explore the purchase of property that could be converted to accommodate permanent supportive housing. The RFI closed on May 15th. We are reviewing and evaluating bids to determine how best to incorporate hotels into our emergency shelter and traditional housing systems. The administration is committed to providing a forum for community collaboration and input to inform how we leverage new HUD and American Rescue Plan funds to address the critical needs of those who are currently in shelters and those experiencing chronic homelessness and encampments. And finally, I would like to thank the countless volunteers, stakeholders, and community organizations who have partnered in this critical effort. This is transformational work, and it cannot be done alone. We need and have been fortunate to have the support of our partners who show up every day and are helping us realize our shared goal of ending homelessness in Baltimore. That said, I am proud to say that we have a pretty nice bench of leaders who are here to respond to questions related to our response for COVID-19 and the plan ahead. So that concludes my remarks, Madam Chair.
Thank you, Mr. Shorter. Does the committee have any questions for Mr. Shorter? I know he's going to have to leave shortly for another obligation, so this is your time to ask a question specifically to him.
Yes, Madam Chair, I have a question.
Yes, go ahead, Councilman Dorsey.
Thank you. Mr. Shorter, do you know whether the Housing Authority has accepted the full allocation of the 278 emergency housing choice vouchers that the city was allocated?
I do not. The Housing Authority is present and will be able to answer that question. I know that this was an issue raised, but I do not want to get that detail wrong. So Housing Authority should be able to chime in.
Okay, great. Thank you.
No problem.
This is Anthony Williams. You hear me?
Yes,
Right.
Mr. Williams.
Yes.
I know I'm asking the committee, but let's check with the committee first to see if they have any questions before Mr. Shorter leaves, and then we'll come back to you if you have a question for him. Do you have a question for him? I can't hear you.
Mr. Williams, you may be on mute.
Yes, I have a question for him.
Okay, one minute. Any other committee members have any questions for Mr. Shorter? Hearing, yes, Councilwoman Ramos.
Thank you, Madam Chair. I think Councilman Stokes also has a question. Mr. Shorter, yeah, thank you, Mr. Shorter. I appreciate your, and because you sort of came in the middle of all of this, and I guess we'll hear from MOHS, and I can ask these questions as well. But what's the status of the federal funding coming in to reimburse the city for the hotel stays, and how long do you think that's going to last?
Yes, I know at this point FEMA, and you're right, MOHS will elaborate. FEMA has at this point sent $29 million. I believe our budget team is on the line as well to provide additional details. The process of reimbursement has been smooth. And I will say that urban centers across the country who have all been dealing with this pandemic and the intersection of homelessness have been experiencing in the last few months a very smooth FEMA process in terms of reimbursement. A much smoother, I should say, not very smooth, but much smoother.
Thank you.
Yep.
And then you said that Councilman Stokes had a question?
Can you see my hand, Councilwoman?
No, no, I can't.
Okay.
I have something that's blocking a lot of the attendees.
Okay. Director Shorter, how you doing, first of all?
Very good.
I want to mention, because I sit on the Continual Care Board, and I actually, if you go over to Bath Street, I was able, along with Councilman Costello, we were able to, because we talk about, we have all these people feed our homeless people, well, how are they going to use the bathroom? So I was able to get a mobile unit that's been there for 2 years, and actually they get a chance to have a shower, take a bath. Some of them have got employment. They have clothing. So that actually worked for the last 2 years. And over in Oliver community, we working with Healthcare for the Homeless. We are building a 54-unit permanent housing for homeless people throughout. They come through Healthcare for the Homeless. And I know Mayor Scott said something about the hotel. And the reason why I'm kind of using that story, because we keep saying we play checkers with this. We play move them here, move them there. It's a chess and checker game. Our conversation should be more about permanent housing like we doing in Alva. And I think as the director, that's something that the conversation should be starting as permanent and stop. We can't keep playing these checker games, chess here, move them there, move them there. And I know they get frustrated. So it's just a suggestion, maybe we should start saying permanent housing out of our mouth. And one other thing I want to mention, I know this, I believe it's in Councilman Costello's district, the old Social Security building. You got homeless people sleeping at the door right there. That's a very large building. Have y'all ever even thought about, and I know they probably got to go through the federal government about maybe you can utilize some space there and it become some permanent housing. So it's more like some suggestions and just telling you exactly what we're doing over in Oliver too.
Councilmember, I really appreciate that. I will say that you are absolutely right that there's a very big difference between rapid rehousing, transitional housing, shelter, and what we know as permanent supportive housing. I will say in terms of designing appropriate permanent supportive housing, it should feel and be home-like. And oftentimes what we find in buildings that were used for other purposes, it is much more complex to create a home-like environment that individuals and families will feel comfortable in for years to come and feel comfortable calling home. So as we think about and design permanent supportive housing options, you're absolutely right. We need to call it permanent supportive housing. We need to be clear about that, and we will be. But we also need to keep in mind that there are very unique standards, very specific standards that we use when we are building and investing in properties that will be the home of individuals and families, as permanent supportive housing should be.
Thank you.
Thank you.
Any other questions on the committee? And seeing no hands raised, I know that Mr. Williams, you're on the panel, and there are specific agencies
It's okay.
that.
It's okay. I'll say it during the my time.
Okay. Thank you. And one last time for the committee members, any questions to Mr. Shorter? Hearing none, we're now going to go ahead and move to the public testimony, and we're going to start with the panelists. And there is a presentation from the first group, Homeless Persons Representation Project. And Anthony Williams and Carolyn Johnson are representing. Does Ms. Johnson want to be made a presenter? Are you?
However you'd like to do it.
However you'd like to do it, which. Okay, hold on one second. They're moving you up. And is there a PowerPoint presentation you want to share as you're presenting? I have something here.
So I can do that right now. Just let's see if it works correctly. There we go.
Okay, you're on.
Okay.
So it's
Thank
you,
Madam Chair.
Okay, you and
It's
Anthony
me.
Williams.
Correct.
Okay.
Thank you, Madam Chair, and thank you to Councilwoman Ramos for introducing this resolution, and to all the committee members for continuing to elevate this issue in this committee. You know, the affordable housing crisis has been persistent and longstanding in this country and in Baltimore City. But we also know that we must dramatically increase the supply of affordable housing if we are going to be able to house our unhoused neighbors and end homelessness in Baltimore. Currently in Baltimore City, a full-time worker needs to earn over $55,000 a year to afford a 2-bedroom unit. And for every 100 households in Maryland, we only have 32 affordable and available rental units. Baltimore City share of the lowest income families at or below 30% of AMI, and we have a shortage of over 28,000 affordable rental units to these families. The lack of affordable housing and homelessness is a race equity issue. Housing cost burdens, housing instability, and homelessness disproportionately impact Black households, while Baltimore City residents compose 63% are Black. 70% of people experiencing homelessness are Black. 85% of homeless youth are Black. And families with children experiencing homelessness are Black. So as we plan to move forward, it's important to view our affordable housing development and other homeless services through a race equity lens. Now, some of the good news. The American Rescue Act plan is providing significant resources to Baltimore City. Some of these resources are targeted specifically at individuals experiencing homelessness. One program is the Homelessness Assistance and Supportive Services Program. Baltimore City will receive $15.4 million to the city's Department of Housing and Community Development through the existing Home Investment Partnership Program that can be used to house individuals who are homeless or at risk of homelessness, can be used for tenant-based rental assistance, development of affordable housing, supportive services, and the acquisition and development of non-congregate shelter units. You heard Mr. Shorter speak about the request for information that Mayor Scott has released, attempting to purchase a hotel for a non-congregate shelter. And we're really pleased to see that happening. We think it is a model, it's a good first step. And we also think that we should be using this opportunity to completely reimagine our shelter system and to provide all shelter units as non-congregate, to allow individuals to live in a space that allows them to retain their dignity and autonomy and some privacy. So we really hope that the purchase of the entire system moving forward. We also are getting 278 emergency housing vouchers. The Housing Authority has accepted these. They issued a press release earlier this week. These are, again, emergency housing vouchers targeted to people who are homeless, at risk of homelessness, and individuals fleeing domestic violence. The Housing Authority will also receive close to $1 million in a service fee, which can be used for housing search assistance, application fees, security deposits, moving expenses. These are all really essential when housing individuals who have experienced homelessness and housing instability. These are barriers to access to housing, and we're really thrilled to see HUD starting to recognize that and provide funding specifically for that purpose. The Housing Authority is required to partner with the continuum of care on these vouchers, and the vouchers will primarily be distributed by referral through the continuum of care's coordinated access system and possibly through victim service providers. The other large pot of money, which I'm sure the council is aware of, is the coronavirus local fiscal recovery funds. This is and over $600 million coming to Baltimore City. The Department of issued its regulations on this funding earlier, I think last week, and specifically that the funds can be used for programs or services that address housing insecurity, lack of affordable housing, and homelessness. This can include permanent supportive housing, development of other types of affordable housing, and housing vouchers. We understand that there are a lot of competing interests for this pot of money, but hope that affordable housing will be given some priority, and that when affordable housing planning is done, that we look to prioritize those who are most at risk of housing instability and homelessness, and those are the families with the lowest incomes at or below 30% of AMI. It was also great to hear from Mr. Shorter that they're already thinking about a transparent and inclusive decision-making process. We need to ensure that persons with lived experience of homelessness are heard in this process, and suggest that they be provided compensation for their participation in the planning process, and also make sure they have the technology that they need to fully participate in this process during COVID. Lastly, other potential resources. This committee has a bill before it, Council Bill 21-0004, the Office and Home Permanent Housing Voucher Program. This program would implement a moving on strategy using local vouchers, which will increase the supply of permanent supportive housing. Individuals currently in that housing will have an option to move out of permanent supportive housing if they no longer need those intensive supportive services and use the local voucher as a permanent rental subsidy. That opens up a permanent supportive housing unit to a new family who's experiencing chronically homeless and needs supportive services. This bill will create a new office on homelessness that will administer the local voucher program with funding from the Affordable Housing Trust Fund. So these are really the main pots of money that are coming down from the American Rescue Plan that can be used to address ending homelessness through the creation of more affordable housing. And Anthony Williams will speak next from the Lived Experience Advisory Committee.
Anthony Williams, you're on.
Okay. Hi, my name is Anthony Williams, co-chair, and myself and Hannah Roberts, we founded the Lived Experience Committee. And that was during a time when she was working with the Department of Homeless Services that we created a Lived Experience Committee. Well, actually, formerly known as the Consumer Advisory Committee, now is the Lived Experience Committee. When COVID hit, 2 directors were fired from the Mayor's Office of Homeless Services. And we've worked closely with the director and deputy director, which one of the directors now work for HUD, okay? They fired them, and then the door was shut in our face. Therefore, all the work, the 5 years of work that we put into the 5-year plan, the shelter transformation, all the things that we've worked on, we also was able to raise millions of dollars to hire 6 outreach workers through that committee. I'm also on executive board of the Continuum of Care and the co-chair of the Lived Experience Committee. In order for us to move forward as the Lived Experience Committee, there has to be a change in the Mayor's Office of Homeless Services. If we're going to end homelessness, we need people that are willing and able to work alongside with the LEAC, right? Because we are federal, right? And according to the Federal Register, on all levels of the decision-making processes that deals with any funds and money that comes in our name, homeless or formerly homeless. It's very hurtful when the city does not inform us on the vetting processes of a new director and the vetting processes of a deputy director. They didn't reach out to us until the last minute. They reached out to me on a hearing. You know, they reached out to me to meet our new director of homeless services before she was hired. But in that meeting, the deputy director was representing the housing authority. And when that happened, again, that felt like they're working around us, not with us, not talking to us. And these are the things that we've been dealing with since COVID. And you will hear testimony from other individuals experiencing homelessness now. You're going to hear from individuals that are probably in rapid rehousing. You're going to hear from people that are currently homeless in the hotels. But I just want to say, in order for us to move forward, we have to deal with the Mayor's Office of Homeless Services continuing to make decisions and these draconian attitude towards homeless people. And with that said, that's what I have to say. And and I'm very hurt. And our committee, the Lived Experience, is still struggling. But we were able to stay strong as a Lived Experience committee. We got 8 members on the board that have formerly homeless or currently homeless experiences. Myself as well. I have a 1-bedroom apartment, which I got through Healthcare for the Homeless while I was experiencing homelessness. So we can, and we will, end homelessness in Baltimore. We have the money, as you see now, and the capability to end homelessness, and not just permanent supportive housing, permanent housing, period. Because everybody don't need support. And we have to also look at coordinated access. Coordinated access leaves out a whole population of people experiencing homelessness because it's geared towards chronically homeless. Everybody isn't chronically homeless. So what happens to those folks experiencing homelessness? They get a lower ranking instead of a higher ranking. So these are issues that we hope that the door is open back up to us because we're outside of the Mayor's Office of Homeless Services looking in, because there is no transparency, no real transparency. And I leave that and I'm done.
Okay, and this is a good reason to take public testimony first. So now we're going to move on to housing our neighbors. Peter Sabonis and Mark Council. Are you there?
I'm Peter. I'm here. Mark Council is going to go first, and he is joining by phone.
He's going to unmute him. He's going to be unmuted. Mark Council, are you there? Oh. Mark, are you there?
Yes, can you hear me?
Yes, so you're going to go first, and then Peter, you're going to go after Mark. Okay.
All right, thank you. Good afternoon, and I want to thank y'all for having me. My name is Mark Council. I'm the lead organizer of Housing Our Neighbors. Housing Our Neighbors are a group of homeless and formerly homeless allies and applicants to fight the right for housing in Baltimore. I've been homeless for the past 7.5 years. And also we have managed to have members staying at the city shelter and the hotels. Housing Our Neighbors is working towards a city without homelessness. This is a goal that was within our reach. And with leadership and partnership, we hope to get there. This is not a dream of ours. This is something that I know if we was to work together, we can do this. First, let me commend the city for extending the hotel contract. this was an important step to save lives. Because like I said before, this is something that we all in this together. While, excuse me, while the hotels are far better than a group shelter due to the coronavirus, the current conditions in the hotels, city shelters at Green Spring, KIP, school must be addressed. We are concerned about the numbers of issues that continue for what we have been hearing about. For instance, the food, the treatment by staff, these things that have heard about and somewhat have seen, it's been going on for a while. The lack of service. Many residents feel as though that it's not that safe there. Again, this is Green Spring Shelter down on Green Spring. Safety in harm reduction. The city must implement common sense harm reduction techniques to reduce overdose and death. Staff also needs to be trained in this. This is something that we have seen several times at one shelter, that dying, maybe some of it consists of overdoses, maybe half of it consists of coronavirus or whatever the reason. But I'm just saying that staff needs to be trained on these issues. Housing choice, the vouchers, transparency. To the three housing, people should be able to go where they choose to go to. And I'm thinking that that's what the system was about the first time. I don't know what happened, instead of the case manager that's taking people and just putting them into a place for a quick, saying, okay, well, we did our job. But, determine where they should live and share. The many have shared with us that they have felt pressured to accept first place they see. And I'm thinking that this is not right for them to be treating like this. It should be the fact that they should live and choose where they should want to live at. Some of them don't feel safe in certain neighborhoods where the case manager put them. Well, we have heard about far as KIP again, that far as that it's basically is a death trap there. They don't have, it's an old school, and nothing's going on there. They have so many complaints that goes on in that building alone. People are being put out by anybody necessary. And I thought it was supposed to be one person in particular, supposed to call somebody, staff's supposed to call somebody to see if whoever gets put out. These people get put out for little things as far as curfew concerned, as far as not bringing things in, food-wise, bringing their medication in. All these things is just little issues, and you get put out in the cold, and then when they get put out from that point on, they go out there and they die. They start troubles. Anything is liable to happen. We hope to see a quick action on these concerns. Bottom line, we need more affordable housing so that no one returns to country shelter. We need this plan to end homeless, and homeless people need to be a part of this process. Again, the city did a tremendous job in extending the hotel. And again, like I said before, Housing Unable want to thank y'all for doing that part. It is a lot more work that we have to be doing, and we can do it together. And now I'm going to pass it over to Peter, who's going to enlighten you about our visions and to create more affordable housing. Thank you, Peter.
Thank you, Mr. Mark Council. Peter?
Thank you, Mark, and thank you, Madam Chair. I'm Peter Sabonis. I'm the Director of Human Rights-Based Development at Partners for Dignity and Rights. That's a national organization that works with grassroots groups that organize around fundamental human needs like housing, work, education, healthcare, income security. I'm an attorney with a public policy background. I previously spent a decade working at the Homeless Persons Representation Project. I had the honor of working with Carolyn. And I'm now assisting HUN's research team on extremely low-income housing development and the supporting public policy that makes that happen. Our team at HUN sees the federal injection of money as a great opportunity to indeed increase the use of vouchers to move folks from hotels into permanent housing, but also to increase the number of hard units that are earmarked for extremely low income persons. Now, a hard unit is a housing unit that is created by new construction or by rehab. An easy way to distinguish hard units from providing people with vouchers is that hard units create jobs in addition to housing. Vouchers address only housing. To date, hard units have been public housing, a range of projects and housing models that are based on various government subsidies, senior housing, housing for persons with disabilities or AIDS, or mixed income housing that's usually provided through low-income housing tax credits. We at HUN have looked at essentially 3 hard unit options. One, the conversion of hotels to permanent housing. Now, that by far is the quickest option according to developers. Indeed, localities use the time-sensitive CARES money to do this, often combining wraparound services or services on site. The Champlain Valley Community Land Trust in Vermont took a 113-unit hotel, rehabbed it into 68 permanent apartments for homeless families and individuals without incurring any debt, which is amazing in the housing development realm. California created a statewide program that incentivized conversion. In Boston, the Pine Street Inn is converting a hotel into permanent apartments where social service agencies will occupy the ground floor. New concept of mixed residential. These opportunities exist now with ARPA funds, with the rescue funds that Carolyn set forth and explained, without the short time limits. So 1, conversion of hotels. 2, conversion of empty office space to permanent housing. The Metro West Social Security building, which was mentioned at 300 Green Street, that's a pre-pandemic example. 8 stories, $1 million square foot, former federal agency hub downtown. That was federal surplus property. And according to federal law, nonprofit groups, state agencies, and local governments had a right of first refusal. It appears to be destined not as a new circuit court, but as a parking garage. But even if those federal opportunities, the surplus opportunities aren't available, there's been a seismic shift in the office and retail commercial real estate markets during COVID. That's going to play itself out during the transition, but the opportunities for conversion will be there if we hunt for them with the same energy and creativity that private developers use. Finally, that's so that we have housing, we have hotel conversion, office space conversion, and finally our old friend vacant housing. Years ago, HUN highlighted the absurdity of vacant housing and homelessness existing in the same city. Putting aside the complexity of each issue, the fact remains that their coexistence is an indictment of how the housing market and public policy. There are public vacants owned by the housing authority, private vacants percolating through receivership or tax lien processes, and even anchor institution-owned vacants. 6 years ago, a HUN survey of a 15-block area in East Baltimore identified 381 vacant structures, 17 of which were owned by Hopkins, 61 by the housing authority. Now, which vacants to reconstruct and where is the challenge, of course, but identifying clusters through agency and anchor coordination and providing opportunities to community-based nonprofit developers interested in doing extremely low-income housing is a tool that should be used. All of this involves money, and while we hope the federal money spigot stays open for more than 100 days, efforts like the Affordable Housing Trust Fund offer us more predictability. We had hoped that the trust fund would be getting close to $20 million annually right now from the surtax and the promise of bonds through the MOU that was signed by the former mayor and city council president. It's not. We're running $5 to $7 million short. We need new sources of revenue for the fund, and we look forward to talking with the council members and the mayor about the ideas for it. One last point, transparency and partnership. This was pointed out earlier, and all of this should be done with the partnership of the homeless community, and they are a community. They can play a role in the governance of hotels and in permanent housing. They are, as the Baltimore Homeless Union once said a long time ago when I first came onto the scene in Baltimore, they are homeless, not helpless. They may not be identified as one of our 240 neighborhoods in Baltimore, but there's a cohesiveness, a connection, a camaraderie, and a caring between them that rivals neighborhoods. You know, I keep this market typology map with all your council districts right next to me when I'm working, and I think you should think of them as the 15th councilmanic district, whom all of you represent. Thank you very much.
Thank you both for representing housing, our neighbors. And now we'll go ahead and move. I know the Mayor's Office of Children and Family Success has a presentation, and also the Mayor's Office of Homeless Services. So hold on a second. So we'll go with Tisha Edwards and Katie Urick. I don't know which one wants to go first, but you decide.
Thank you, Chairwoman. Thank you, Chairwoman Middleton. This is Tisha Edwards, Acting Director of the Mayor's Office of Homeless Services. I am actually doing the presentation for that agency. Katie is going to help me with the slideshow, if you don't mind.
Sure.
I mean, I also want to acknowledge the other members of the committee and other council persons who have joined in this conversation. And I also want to express my appreciation for the panel who shared really great information. And the good news is I think that there is lots of alignment in terms of the path forward and the opportunity that does exist with the influx of new federal funding that is being directly targeted towards supporting our neighbors who are experiencing homelessness. And so, Katie, I'm ready whenever you are. So again, I just want to thank the committee and specifically Councilwoman Ramos for leading the resolution to have this really important and time-sensitive conversation. My remarks today are going to take us through just making sure that the council and the public is aware of our COVID-19 response. which has really been a year-long journey for the Mayor's Office of Homeless Services. It has been a coordinated effort through multiple agencies and really sets the stage for the opportunity going forward. I'd like to give an update on the outreach and encampments work that we're doing on a daily basis, an update on the shelters and hotels, and the work that we are doing to implement a housing first strategy. Next slide, Katie. So beginning in March 2020, as everyone here has commented on, it was really a complete disruption to homeless services. Immediately, the need for expanded services was upon us. There was a complete disruption in the systems and how we deliver those services because of the global pandemic. And the Mayor's Office of Homeless Services quickly moved to prop up 5 hotels to house more than 500 individuals who are experiencing homelessness. We also are a key partner in the Lord Baltimore Hotel strategy with the Health Department and the University of Maryland Medical System, which really gave us a portfolio of about 6 hotels that we have been working within to try to meet the needs of those who are experiencing homelessness. We also knew that we had to work really hard to provide infection control support to other shelters, both city-owned, city-funded shelters, and also the non-city funded shelters. And so we reached outside of that network of city-funded shelters to make sure every shelter in this city had been trained and had proper protocols for addressing the pandemic. We also expanded our outreach and emergency services team. We had to get many, many more boots on the ground because of the, again, expanded need that we are experiencing as a result of the global pandemic. We implemented a coordinated entry call center. We were having a very hard time managing the shelter beds. As Chief Shorter commented in his opening remarks, there were a lot of things happening in one time, which was decreased capacity in shelters because of the CDC guidelines, increased need because of the economic devastation to our community. And so we needed to have a very streamlined approach to be able to make sure that no one fell through the cracks, that we were able to manage the beds and the influx of need that we were experiencing. And so that has been kind of the heart of the COVID-19 response. We moved beyond winter shelter, which was also a really challenging time for the agency, and we're moving into code red, preparing for the summer. I'm very proud of the work that our team is doing to connect with partners. MOHS does not do anything alone. Everything it does is with a very, very strong set of providers and community partners who help us to meet these critical needs. And so we are now preparing for code red. We are still dealing with the pandemic. And so we're making sure that we have a shelter in place strategy for those really, really hot days, making sure that our neighbors have access to cooling centers, and that those cooling centers do not become super spreader locations, that they also have infectious control protocol so that we can continue to do everything that we can do to keep everyone safe while we are fighting off the global pandemic. Next. We have worked really, really hard to make sure that the vaccine is readily available to our neighbors who are experiencing homelessness. We work hand in hand with the Health Department, Healthcare for the Homeless, and tailor-made transportation to make sure that Our neighbors can get to these mobile vaccination clinics, and that accessing them is not a barrier. And so there's been just an extensive coordination to support that effort. Through our direct mobile vaccination strategy, 550 clients and service staff are vaccinated. We are also very grateful for Healthcare for the Homeless for setting up an ongoing vaccination center Monday through Friday through our partnership with Healthcare for the Homeless, again, which we are very grateful for. We have over 1,500 neighbors who are experiencing homelessness who are fully vaccinated. That is not enough, but it is a great start, and we could not have gotten this far without the support and partnership of Healthcare for the Homeless. I also want to lift up our partnership with Downtown Partnership. They have also been a great partner in our outreach work, particularly to those neighbors who are in encampments. And both Downtown Partnership and People Encouraging People have all helped to make sure that we can create as much access as possible to the vaccine. Next slide, Katie. Beyond the kind of core COVID-19 emergency strategy that's being implemented by the Mayor's Office of Homeless Services, a part of that has been really expanding our reach in an outreach, and particularly in our encampments. The Mayor's Office of Homeless Services, People Encouraging People, and Downtown Partnership, we conduct outreach in all 14 council districts to offer shelter, housing resources, supplies, and PPE to people experiencing unsheltered homelessness. There are currently 14 active encampments in Baltimore. At the height of the pandemic, there were as many as 22 active encampments. Through our outreach services and our support network, we're holding at about 14 now, down from, as I said, at one time, about 22. And as Councilwoman Ramos said in her opening comments, we have been operating in accordance with CDC guidelines and have not closed any encampments, but have been very, very diligent in offering services, including housing and shelter. We have a very strong partnership with the Franciscan Center, and they are our lead partner in delivering meals to our encampment residents. We also have a mobile shower located near Healthcare for the Homeless, and that shower is available Monday through Friday and on some Saturdays, again, to try to provide resources to our homeless neighbors who are currently unsheltered. Next slide, Katie. So we've provided over 21,000 services through our outreach team in the past from year to year, from March 2020 to March 2021. And that's a huge increase from the level of service that we have historically provided because of the growing needs in our community. We're very proud of the partnership with People Encouraging People, Downtown Partnership, Healthcare for the Homeless, and other community partners, including real care providers. We had a really strong partnership around supporting the needs of those who were homeless and at the I-83 bridge. We're very happy that through that partnership, we have provided direct support to over 90 individuals who are experiencing homelessness and provided them with more stable housing and appropriate wraparound services. We see this partnership as a model for ongoing support at our encampments. One of the topics that we've talked a lot about today is what's happening with shelters and hotels. And just for the council and the public's information, we wanted to let you know that, again, we do have 5 hotels that MOHS is responsible of managing. And since the beginning of the pandemic, we've spent about $14 million to sustain those hotels, which is now gone beyond a year and is approaching 18 months of having those contracts in place. The city's finance department is the lead on FEMA reimbursement, not MOHS. But we are happy to hear that there is progress being made in terms of the FEMA reimbursement process, that the connection with the federal government is much more aligned than it was previously under the prior administration in the federal government. We have extended our hotel contracts until September. We will continue to review those contracts and where we are with some of the other things that we're planning to do as a part of the post-COVID strategy, and like potentially acquiring hotels to support both addressing the need of congregate shelters in our city that are still in our portfolio and other housing options. So the current contracts at the hotels are important resource to us as we now begin to plan for our post-COVID strategy and the activation of the influx of federal dollars that are being made available to us. Next slide, Katie. We are focused on the emergency response. We're focused on outreach and supporting our neighbors who are in encampments. And we are also really driving our housing first strategy. We understand that that is the ultimate goal, is to get as many of our homeless neighbors into housing as possible. I appreciate the panel and others lifting up some of the challenges that are associated with the housing first strategy, and that ultimately we need to have more affordable housing available to us in Baltimore. We agree with that 110%. And I think that MOHS is very well poised, both with its partnership with HABC and its partnership with DHCD, to address this need in a way that we have never been able to do before. We, since March of last year, have moved 579 individuals and families into a housing program, either our CSG CV rapid rehousing program. We had our traditional rapid rehousing program, that we had in place prior to receiving the CARES funding, and permanent supportive housing. So we are continuing to use all 3 of those programs to support moving individuals into housing as quickly as possible. We also want to acknowledge, again, the partnership that we have with HABC. We think it's getting stronger. And we know that HABC knows that they are essential to helping us to address the needs that we're currently seeing. In the past 2 months, we have finalized MOUs with HABC to receive another 160 housing choice vouchers. This is outside of the 278 that they were recently awarded and accepted. And then, as I said, we have this additional 278 that has come through the American Rescue Plan. So, this is a really monumental opportunity between both the 160 and the 278 to really create some opportunities to really move folks out of homelessness and into housing, permanent, stable housing. Next slide, Katie. We have been working really, really hard to implement the ESG CV rapid rehousing program. As of May 12th, 137 rapid rehousing offers have been accepted by clients who have been experiencing homelessness, and 37 of those clients have already moved into their housing units. I want to make sure that the committee knows that we consider those individuals who are unsheltered a priority for all of the housing work that we are implementing now. Of the 189 clients that were referred to our rapid rehousing program, 20 of those individuals were experiencing chronic homelessness or living in an encampment. So we are doing direct outreach and making the rapid rehousing program available to those individuals who are currently unsheltered. 131 of our rapid rehousing clients that we are moving through the process are individuals who are in our hotels that we are now moving into housing. And part of this notion of making sure that there's a safety net for those individuals who are in hotels, I think Councilwoman Ramos, you asked, what's next? What's going to happen? How do we make sure that these individuals do not become homeless after we've moved them into our shelter? This is why the vouchers from HABC are very important. The rapid rehousing program is very important. Those resources are being targeted towards two essential groups. Those individuals who are unsheltered in encampments, and those individuals who are currently in our hotels. Transitioning and making housing available to both of them, or those groups of homeless individuals, is very important to our strategy. So when you say to us, like, what are we doing to make sure that we don't take a step back, but that we keep moving forward, the rapid rehousing program and those vouchers are really critical to that process. We also have a traditional rapid rehousing and permanent supportive housing program. $21 million of our federal allocation from HUD annually goes to supporting individuals who have been homeless and making sure that they have the resources to stay in their current homes. That's about 1,600 clients that we provide direct rental assistance to. And that's a long-term commitment to make sure that, again, they do not become at risk of experiencing homelessness. We also have in the Mayor's Office of Homeless Services a partnership with the Mayor's Office of Children and Family Success. We have provided $14 million in back rent to over 3,000 families. These are families who would have been homeless had we not been able to provide that direct support to them. And so we are trying to cover all parts of the spectrum and the continuum of care and support that families need by those who have homes, keeping them in their homes. Those who are unsheltered, moving them as quickly as possible into the coordinated access process so that we can get them housing either through rapid rehousing or through one of our voucher programs. Next slide. That ends my formal comments and presentation, Madam Chair. And again, I want to thank you and the council for giving us an opportunity to provide an update on our services that we have been providing to the community.
Thank you. That was a very thorough presentation with you and Katie. And we're now going to go ahead and move on to, there were some other agencies that I guess had quick report statements, and we'll start with the City Solicitor's Office. Hillary, are you still here? Hillary, is there, oh, I see her on here. Hillary Ruley, do you have a report? Moving on to the Department of Finance. Aaron Moore or Mara James were on.
Good afternoon, Madam Chair,
hi.
and members of the committee. It's always a pleasure. Aaron Moore, representing the Department of Finance, Assistant Budget Director. So the Finance Department did submit a report, and we just want to, reiterate our support and great partnership with MOHS and all of the agencies who've been working to do this great work over the past 18 months or so. The finance department is coordinating the FEMA reimbursement process in partnership with those agencies for sheltering and quarantining costs, in addition to all of the costs that the city will be reimbursed for over the next few months. We're expecting a total of 70 million to apply to the federal government, and we've received commitments for a large amount of that so far. And with that, I will defer to my other agencies that are present here today, and we'll take any questions on any fiscal inquiries.
Thank you. Thank you, Mr. Moore. And we'll now move to the Department of Housing and Community Development. Alice Kennedy?
Yes.
Hi, Alice.
Good afternoon, Madam Chair and members of the committee. I'm Acting Commissioner Alice Kennedy, representing the Department of Housing and Community Development. I'm also joined by Stephanie Murdoch, our legislative liaison, and am pleased to be here to discuss the Council Bill 21-0028R. We are pleased to address the council and to discuss the city's plan for our unhoused neighbors residing in hotels during the pandemic. DHCD fully supports the work of MOHS, HABC, and nonprofit providers to provide rapid rehousing for those experiencing homelessness. A member of DHCD's senior leadership team participates in a bi-weekly work group to help support these efforts. We stand by our report in support of this resolution. While we are not directly involved in the housing of individuals in hotels or outreach to individuals in encampments, DHCD is firmly committed to the creation of and preservation of affordable housing throughout Baltimore. We recognize the great need that exists in our city for additional affordable housing units to meet the need of our unhoused and our housing unstable residents and families across the city. DHCD utilizes multiple different funding sources to help support programs and projects to assist in developing new affordable units and preservation of affordable units. That comes through the form of the Affordable Housing Trust Fund, federal home funds, low-income housing tax credits, different state of Maryland programs, as well as our own Community Catalyst grant program. Some of the projects that we have been supportive of recently include Sojourner Place, which is providing several, not just several, but many units to provide permanent supportive housing. That's a partnership between Episcopal Housing and Healthcare for the Homeless for that development, as well as additional affordable housing projects across the city. We know that there is a significant need, and we are dedicated to continue finding additional resources and effectively using those to help support our members of our community that are experiencing homelessness, and to have that, as CEO Shorter said earlier, to be as brief and rare as possible. Thank you.
Thank you. And now going down the list, I'll go back. Is there any representative from the city solicitor's office? Hillary, are you there? I know they gave a favorable report, but she's not coming through at this time. I'm checking to see if there's anyone else on the list. Okay, Jennifer, at this time, we'll see if there's any added statements or comments on the attendees. Please use the raise hand function. I do see someone with a hand raised. That's an attendee, Audrey Kelly.
Hi, my name is Audrey Kelly. Can all of you hear me?
Yes.
Great. So I'm a clinical social worker at Healthcare for the Homeless, and I also live in Baltimore City and District 3. And I just wanted to come today and talk about this issue. I think everybody knows that homelessness is very stressful, very traumatic. And I talked to one of my clients today in preparation, and I wanted to share his words with you. he lives in Baltimore in the 12th district. And he said, when I was homeless, it made me feel like I was nothing. You feel ashamed, you can't take a shower, you can't wash your clothes. He said homelessness gets people so bad that it takes over their minds. So many of my clients have become homeless because of trauma. They've experienced family violence, foster care, incarceration, house fires, extreme poverty. When people are homeless, they're also vulnerable to additional trauma. And I'm really glad that Baltimore City stepped up to house people in hotels last year. And I thank you for extending the contracts. It's made a big difference in the lives of many of our clients at HCH and provided an additional measure of dignity and privacy. At the same time, people who live in shelter hotels have security concerns, and they have a lot of stress, or they've had stress related to contract extensions. When I talked to my colleagues and staff about the mayor's office buying a hotel, the most common concern was about security, safety, and staffing. So we know that shelters are not a permanent solution. The solution is affordable housing. And I strongly support all efforts towards permanent and affordable housing. When my clients get housed, I see their stability improve dramatically. They have fewer hospital visits, less substance abuse, their mental health improves overall, and they're able to reconnect with family. So in closing, I'm going to share my client's words with you about the impacts that housing had on him and how adding additional housing options in Baltimore City would help. He said it would bring us some hope. It would reduce drug use, it would reduce crime, and it would help us feel like someone in the city really cares. Said that's what housing did to me. It gave me hope. It felt like someone really cared about me. So thank you for the opportunity to speak today.
I see Councilman Dorsey. Well, I thought you had your hand up. I don't see him.
Yes, thank you.
Oh, go ahead. Go ahead, Councilman.
Thank you, Madam Chair. It seems like we heard from all the agencies. When I asked the question earlier of Mr. Shorter, he said that it sounded like somebody from HABC was here. I was trying to get an answer to that question that I asked if HABC had accepted the full allocation of emergency vouchers.
Faith Leach. Faith, are you here?
Yes, I am here.
Can you answer the councilman's questions? Or the question that he asked, I don't see a representative from HABC on this call.
Yes. Yeah, thank you for the question, council member. I will happily follow up with HABC and make sure that we get you a response to that question.
Does
Councilwoman
anybody here know the answer to the question?
Yes, Councilwoman.
Tisha Edwards, yes.
Yeah, thank you. Sorry about that. I didn't know if you heard me. Yes, Councilman Dorsey, HABC has officially accepted the 278 vouchers. There was a press release to that effect earlier this week. And we are in conversations with them about the process to distribute those vouchers. The regulations does require there to be an MOU between the continuum of care and HABC on the distribution process. And so those conversations are starting to happen. MOHS is also at the table. But yes, Councilman Dorsey, we are definitely going to take advantage of that resource.
Great. If I may, is there any other relevant information? Like, is there a staffing increase that's necessary in order to accommodate this, or is there a timeline for establishing an MOU, or anything else like that you know about this?
Yes, sir. What I would say is that the vouchers should become available by July 1. And again, the coordinated access process is required to be integrated into the distribution plot process. And again, it is in partnership with the COC. But we are working through the details of that. developing the MOU, and the intention is that those vouchers are available beginning in July, and all of the program details associated with that would be available then. I cannot speak, Councilman Dorsey, to any staffing needs. That's something HABC would have to determine once we have the specifics around the distribution process.
Thank you very much. Really glad to hear this. Thank you.
Audrey Kelly, you can put your raised hand down. So is there any other attendees or phone attendees that would like to make a statement? Put your hand up, or and I see Jeff Garrett. Jeff, you can go ahead.
Can you hear me? Hello?
Yes, yes.
Yes, hi. My name is Jeff Garrett. I am a member of our continuum of care. I am formerly homeless. I totally support the bill that would enact a homeless service coordination strategy. One of the things and the issues that we have within the system now is nobody's in a position where they can actually hold anybody accountable for anything because of the way the system is organized at this moment. From a COC standpoint, from the other providers, we put all these things in place, but nobody can actually hold anybody accountable for doing what they say they're going to do. And as you all noticed, it's very difficult to get the information back from the collaborative applicants that you're working with, that they're really not participating as they should be. We need new types of leadership. We need forward-thinking leadership. Can't go back to converting to the same old ways, just calling it new. Those old draconian punitive methods that don't allow the homeless individual to make autonomous choices that benefit their lives, which is the only way that they're going to be successful at getting out of homelessness, is for them to make their own successful choices. Then we're never going to get out of this situation. So I hope that what you've seen today is just even more proof of the need for this, and I support it 1,000%. Thank you.
Thank you. And just to say again, this is an informational hearing, so that's why we're gathering more and more information from all the meetings that the administration seems to have been having. And there's another hand up. Sarah Bueller, I know you sent a message about you don't know how to do the hand raise, but you can, you're unmuted now. You have a statement that you'd like to say? Sarah Bueller?
Yes, thank you. Thank you. Sorry, my technical difficulty
That's
there.
okay.
Yeah, I had a few questions. I've appreciated this conversation and this resolution. I did want to just take a step back. We seem to have been really focused on federal funding. And I do think it's really important HABC accept those vouchers were being handed. But I did want to ask a question about the city budget. I think it's really great we have federal funds that doesn't take us off the hook to really make the moral choice on how we spend our dollars. And, a resolution expresses values, but the budget is what can either make or break those values. So I just wanted to share a quote. This is from Organizing Black, and they said, "Public safety is enhanced when people are incorporated into the social and economic life of the community, including groups that have traditionally been marginalized." So with that, I did have a question to the panelists with lived experience who are on this call. And that is, what do you think would increase public safety for people experiencing homelessness right now? More police funding and police overtime, or more units of affordable housing? And the follow-up question is for Councilwoman Ramos and all of the representatives on the committee. And that is, will you support an increase in the BPD budget or advocate for those funds to go toward affordable housing and all of the beautiful things we've been talking about on this call? So if we could hear first, I would love to hear first from those with lived experience. Again, what do you think?
Thank you for your testimony, and thank you for your testimony, and we'll get someone to respond from an agency. Do I have Tisha? Can you respond to her question?
Unfortunately, I cannot. I think her question is more related to the upcoming budget that will be presented to the council, and so I will defer to others, and including the Department of Finance, who is also on this call.
Yes. Aaron, are you still on?
Yes. So as Tisha mentioned as well, these are details that will be discussed throughout the budget hearings that will be coming up June 1st through 7th, including an MOHS budget, MOCFS budget as necessary, and HCD as well too. So although we don't have exact details right now what allocations are where, that information is available on the Department of Finance website at bbmr.baltimorecity.gov.
Thank you. And just to add, on behalf of the committee, and Councilwoman Ramos can chime in, but we are also getting prepared for our week-long budget process and hearings where we call just about every agency before the council, and we go in detail with questions and answers. And I'm sure that the Mayor's Office of Family and Children Success and Homeless Services are on the agenda for discussion with the council. Councilwoman Ramos, did you want to comment? I think she had called you out for a specific answer as well.
Yeah, sure. Thank you, Madam Chair, and thanks for the question. Very soon we've got to really have this discussion about, we've all talked about it today, and I've been talking about it for my career. We need to invest in our communities. We need to have a solid conversation about how we're going to do that. I have been very clear, even talking with the mayor's office, that we need an actual investment of $200 million for the next 2 years to make this work for all of our neighbors experiencing homelessness, and also for being able to have enough inventory for people who want to move here as well. And we have to invest in our communities that have traditionally not been invested in. So I'm committed to try to figure out how to get that. I'm using 200 million. I know we need more. And so it's got to come from somewhere. We've got to really think this through and make this a priority, because in my mind, we can't address a lot of these issues, both social issues, our vacant properties, our public safety, unless we're investing in our communities. So I look forward to the budget hearings next week. Madam Chair, thanks a lot for letting me answer the question. And I'll certainly, have deeper conversations with Sarah and with others as we go forward with the budget process, and also as we think about this moving forward in the future. And I just wanted to add, if you don't mind, Madam Chair, thank you to the agencies and the Mayor's Office of Homeless Services for the great presentation. I do have some questions, but I know we're about to run out of time. So we'll hold those, I think, till next time. Sarah just reminded me that the other question was for Mr. Anthony. He's no longer on as a panelist. So maybe we can either elevate him or have a separate conversation.
You'll have to have a separate conversation. Can't be elevated. But I do want to remind people again that this resolution is not going to be voted on today. It's a we could have continued conversation for a very long time. So that's why, thank you, Councilwoman Ramos, for wanting to keep this open, and we're going to, down the road, pick another date to add on, and participants can really bring up your questions and so on. And I'm sure that it'll give us time, will give you time after we go through the budget and approve the budget. There was one other person that has been patient, an attendee that we are going to hear, and then we're just going to, if there's any others, please hold on till we have our next continued conversation. And I think the person's name, I apologize if I pronounce it wrong, Geraldo Benavides from Yes.org. Are
Hey,
you
hello?
there?
Yeah, I'm here. Can you hear me?
Yes.
Oh,
You're
yeah.
going to be our last one for the evening.
All right. Thank you. Thank you for your time. And it's Gerardo Benavides
Okay.
from the Yes Drop-In Center from Youth Empowered Society. First off, just wanted to thank you, Councilmember Ramos, and you, Councilmember Middleton, for all your leadership on this. Really appreciate the open dialogue around this informational hearing. So for folks who don't know, Yes Drop-In Center was founded by formerly homeless youth and their allies, and is currently Baltimore City's only drop-in center for youth experiencing homelessness. And we work to end homelessness through direct services, through youth leadership, and engaging in other systems level reform with the youth leaders that we work with. So we work with young adults ages 14 through 24, again, around a lot of service provision, around a lot of youth engagement and leadership. And I just wanted to highlight at least our experiences that Yes has seen firsthand the very extreme negative impacts that the COVID pandemic has had on our youth experiencing homelessness and the folks that we see and that we work with. Over the course of the pandemic, there have been so many situations where youth have either reached out for emergency housing or shelter supports or services that were already lacking before the pandemic and which are now reaching a crisis point. Youth are not able to consistently connect with the only youth-centered shelter in the city due to capacity concerns. And honestly, the city's rollout of using hotels as shelters has not always been youth-centered. Youth have always had some difficulties getting into the hotels, partially due to some bureaucracy, partially due to lack of clarity as to how to best get connected. One or two of the things I wanted to note, first being, Yes did work with our partners from Charm City Care Connection and the Johns Hopkins School of Public Health to develop and we released a qualitative report to evaluate and demonstrate the importance of having safe, dignified, supportive housing for youth experiencing homelessness during this pandemic. And as we saw, a lot of the negative impacts of the pandemic and how it was affecting our youth was affecting their ability to get stable income, to get connected to care, and that by providing folks with emergency hotel shelter, we were able to better connect them to care. We saw improvements in physical and mental health. We saw the positive benefits gained from having that emergency shelter in hotel-style emergency shelter amidst the pandemic. That being said, we truly believe that Baltimore City should prioritize permanent supportive housing, and I'm glad that's been said by multiple people during this call, that the city should prioritize a housing first model, but that first and foremost, the city should continue to work in collaboration with youth experiencing homelessness to not only build these systems and build this housing, but to make sure that youth can also get connected to these opportunities. Youth and young adults are far too often left out of these city systems as part of this old school way of thinking that youth should not be prioritized, and we want to prioritize youth in all of this. And we have the youth leaders. We have youth leaders who would like to see more involvement, who would like to see more housing available to youth, and we're looking forward to working with you all to change these old adultist, racist, archaic structures that keep youth out of experiencing or to keep youth out of these systems that truly prioritize housing for them. So again, urge you all, thank you all, but urge you all to, again, emphasize permanent supportive housing, emphasize a number of different housing options, and to reiterate that youth should be at the center of all of these systems, and that we should have housing available for the youth in our city.
Thank you, Geraldo. And so at this time, are there any questions or comments from committee members or agencies? Any final comments, and we'll close out until our next meeting. Again, we're not going to vote today. We're going to take a recess. Any final comments from agencies or committee going once?
Madam Chair,
Yes, you can make some final words, Councilwoman, if you'd like.
thank you. Madam Chair, members of the committee, thanks for your time today. And of course, for the Office of Homeless Services, as well as HPRP and HUN. I think this was really excellent. I have a lot of questions that I might just reserve for the budget time because they have to do with the budget, if that's okay, Madam Chair. And,
Yes.
And then also, I look forward to the next hearing when hopefully we get to meet the new director and get an update on, because we may not be able, we're not going to do it soon because we've got budget. So get a chance to meet the new director and hear more about basically and how we're going to do this, if we're going to be using federal funds initially, and then we've just still got to continue, the work after the federal funds go away. So I look forward to hearing more about that as well in our next hearing. Thank you, Madam Chair.
Thank you. And at this time, we're recessed until our next meeting, and we'll see you again. Everyone have a safe evening.